Hello, my name is Julie Clark, and today I will be presenting my mission, vision, and value along with my SWOT analysis of the organization I chose for my project. Alliant Quality is the organization I work for, and it is the organization I will do my project on today. They are located in Atlanta, Georgia, where their main headquarters are, but actually we are all working as teleworkers since the pandemic this year has broke out. Alliant Quality has served as the Centers for Medicare and Medicaid, or CMS, Quality Improvement Organization, or QIO, for the past 50 years. We serve Medicare beneficiaries and healthcare organizations that treat those Medicare beneficiaries. And in a journal for healthcare compliance, Fetter explained that CMS QIOs are organizations that will work directly with providers and communities on quality initiatives to improve healthcare provided to and the overall health of Medicare patients. Alliant Quality assists healthcare organizations with quality improvement initiatives for these Medicare beneficiaries, and we actually cover 7 states. Tennessee is one of those states, along with Louisiana, Alabama, Georgia, Kentucky, South Carolina, and Florida. We work with nursing homes, hospitals, and other healthcare organizations that serve Medicare beneficiaries. And we actually have to follow task orders that come from CMS. This is a voluntary program for organizations to sign up for, so there is a part of our work that is involved in enrollment. Alliant Quality has staffing which consists of a board of directors that is directed and held mainly with our leadership along with CMS appointed contract officers. We have 130 staff on board, and as I shared, we are all working telework positions right now. And our leadership is proudly medical professionals, so we have many doctors that are on board with us to lead our improvement work. Alliant Quality population and demographic, we serve the hospital, healthcare organizations, community organizations, nursing homes, and across those 7 states, like I said. But our main client or customer is Medicare beneficiaries. There are 12 total QIOs across the nation. Alliant was one of those, but then there are 11 others. And as you can see on this slide, an administrator explained in an article that CMS contracts with one organization in each state, including the District of Columbia, Puerto Rico, and the U.S. Virgin Islands, to serve as that state's QIO. So again, Alliant covers that for 7 states. We have quality tasks from Alliant, and in this article, in the MENA 2016 article, it was shared that CMS expects that all the work that the QIO does will focus on Medicare beneficiaries, and it will result in systemic change that improves all of the care provided to these facilities. So kind of a trickle-down effect. Currently, we are working on reducing hospital readmissions, reducing opioid usage, improving quality measure scores. Those are within nursing homes and have to do with things that are reported to CMS on many different topics, including falls and urinary tract infections and other healthcare acquired conditions. And improving overall star ratings at nursing homes. That is another piece of the Alliant Quality work. The segment under QIO work for communities involves facilitating community coalition meetings. These are virtual right now, providing data for these community meetings so that they can identify what areas to improve, and then helping them to move through improvement efforts on whatever those topics might be. Alliant Quality outcomes for the past scopes of work that we have had. This is the most recent. We are in our 12th scope of work right now. These are the 11th scope of work outcomes, and you can find these on the Quality Improvement Organization webpage. We had a goal in the 11th scope of work, again, this was the last 5 years, to reduce the percentage of long-stay residents who receive antipsychotic medication. You can see the goal was 15%. And the nation's QIOs were able to get an improvement of 28.2%. So that is nationwide outcomes. Then we had a goal to improve those composite scores that I mentioned earlier that have to do with quality measures around things like urinary tract infections and falls and many more, to improve that by 45%. And nationwide, the QIOs were able to improve to a 59.7 rate. And then helping nursing homes enroll with the National Healthcare System Network, which has become very important during the COVID outbreak. The goal was that we help 80% of the homes that we had enrolled in NHSN to report for 10 months to get them used to that. And again, nationally, the QIOs were able to reach a 98.4% rate of that. Alliant Quality has a mission, vision, and value statement, and they are shared here. They did not have one written, so I had to organize this and write these myself. So the mission statement is that Alliant Quality is a top-performing nonprofit Centers for Medicare and Medicaid, CMS, Quality Improvement Organization, or QIO, committed to improving health outcomes and quality of healthcare delivery. Patients are the center of all our work and our drive to improve health and healthcare. The vision will be for Alliant Quality to strive to be the leading Centers for Medicare and Medicaid, or CMS, Quality Improvement Organization, QIO, in the nation by providing superior outcomes and quality improvement initiatives. And then those values for the workers, I wrote, Alliant Quality works respectfully and collaboratively with healthcare organizations in efforts to improve healthcare outcomes for healthcare consumers. So now I will share a little bit about the SWOT analysis for Alliant Quality. I listed here some of the strengths I believe that this organization has is that they have served as 50 years as the CMS QIO for many states. They've had outcomes from past scopes of work that have put them in the top performing QIOs across the nation. And they do have actually 3 other segments within their organization that will help to create more income for the organization, as you're going to see some of the weaknesses for this organization has to do with changes in future work. They also have 5 years experience with enrollment and reporting in a very vital National Healthcare Services Network program that has become even more vital since the COVID outbreak. So we're able to help with that enrollment and reporting process that's very new to many other organizations. Weaknesses I have listed for Alliant is that they do not provide outcomes agreed on from the contract with CMS. They will lose the funding. So they must obtain the outcomes that CMS sets in the contract in order to get their funds dispersed. They also have lack of work processes when they begin new tasks. I believe this has to do with the fact that the work comes so quickly and it changes so often. But as you can see there, I have cited a resource that explains how important it is to have these work processes in place. Working with as few full-time employees as possible is another weakness for Alliant Quality. And I have another article here where if you go in and read that, you will see that spreading your employees too thin is not a good idea, and it can cause many issues with your staffing. And then they might be covering more states, causing less time with staff to create poor outcomes. So as they move away from being within their home base in Atlanta, Georgia, and they spread out more and more to telework, that may cause a weakness for them not being in touch with their employees as often as needed. They do have opportunities on the SWOT analysis that I have drilled down here to share with you, in that they can apply for other contract work. And actually, Alliant Quality was recently awarded the hospital quality improvement work. So that is something that they're doing on an active basis. They look for and apply to as many contract work availability that is out there for them. They can include more states in their next contract bidding. So the QIO work has gone from one individual organization per state to now we only have 12 QIOs that cover 50 states. And as we move into the next scopes of work, Alliant may want to try to add to the 7 or more states that they have currently in order to be strong enough to continue the QIO work. And then I have collaborate with other quality improvement organizations to build a strong network. This is something that they do right now, and I think as a good opportunity to include in their future work in order to grow the knowledge and experience and best practices that are going on across all of the QIOs. Potential threats to this organization to meet their mission would include a potential removal of funds from the CMS QIO work. This is a government-funded program, so as the presidents change, as funding change within the government, they may see a reduce in funds that is available to them, and we have seen this in the past scope of work. And then I have here reduction in number of CMS QIOs in the country. So again, I stated just earlier on the other slide that we had 50 QIOs. That was back in 2007. And now in this scope of work that we're in now, we only have 12. So, you can see that the CMS is condensing and having one organization cover many states, which is reducing the amount of QIOs that are available. Key points that I'd like to remind you of is that Alliant Quality is a 50-year-old CMS QIO with great outcomes, and they have been able to provide quality improvement assistance to healthcare organizations across many different states. And they're seeking to continue this work and become the preferred CMS QIO based on superior outcomes that they want to showcase and achieve in the coming years. They do have strengths, they have weaknesses, opportunities, and threats. And I believe as long as they stay on focus and are aware of all of these, they will be in business for many more years to come. This is my reference page. If you'd like to review any of the information I have shared in this presentation, I welcome you to review this. And thank you for your time.